Today we broadcast our second interview on burnout with counselling psychologist Vikki Baird. Last week Vikki shared her personal experience of burnout at a time in her life when she was transitioning from study into full-time work. Vikki described a personal trauma caused by burnout while also helping our listeners understand what is burnout, how to know if you're on the road to burnout, and some of the differences between burnout and depression. Now, that broadcast was last Tuesday, and it's available on planetaudio.org.nz/Take It From Us, or on our own radio website at takeitfromus.co.nz. Today we look at burnout, especially among top professionals like doctors and teachers, and just how common it can be in particular careers. We'll also suggest how you can safeguard against it. So welcome again, Vikki, to Take It From Us. The web is loaded with information about burnout among our top professionals, such as doctors, dentists, nurses, psychiatrists, lawyers, teachers and principals. I mean, it was really amazing to do some research on burnout and some statistics around it, and to realise that these career professionals are really affected by burnout. So we're going to talk about that today with Vikki. But let's recap a little bit. Your definition of burnout, Vikki?
Yes, Sheldon. So the definitions we used last week. So burnout can be described as a long-term negative affective state consisting of emotional, physical and mental exhaustion. So that's a key component. Burnout is not just physical exhaustion. It covers all bases. So the person feels depleted emotionally, mentally, physically. It's almost like their tank is empty. So they have nothing, they feel everything feels overwhelming, they have nothing more to give. And even basic daily tasks of life can be so difficult for them. The other definition we referred to was erosion of the soul, which, you know, puts it in a more poetic way, I guess. But I guess that sums up what it feels like for the person.
Well, it's a pretty graphic sort of description, isn't it? Erosion of the soul. I think when our soul is eroded, we're really at breaking point.
Yeah, it really sums up that experience of burnout. Yeah.
So we've got, in the research that I've done and shared with you, we've got a picture of top professionals such as doctors, dentists, nurses, psychiatrists, lawyers, teachers and principals. It probably should include public relations consultants as well, because I'm sure that as a public relations consultant many years ago, burnout was one of the things that I experienced. So what's the reality of burnout among such professionals?
Well, in particular, Sheldon, you mentioned all those professions, but I want to start, I guess, by highlighting how rife burnout is amongst doctors and health professionals in particular. So some of the statistics that we uncovered was that it's almost about half, even over half of doctors actually experiencing very high levels of stress and even burnout. And I find this, you know, quite concerning, I guess, particularly since doctors are in a profession where, you know, they're required to be physically, mentally and emotionally healthy, to have a full tank so that they can, you know, support other people when they're vulnerable. So this is quite a concerning figure, really.
So the survey was done by the Association of Salaried Medical Specialists in New Zealand, and they say that as a group, doctors often neglect their own health, are not good at nurturing their family and social supports, and have few outlets for divesting themselves of the significant emotional load they carry from their work. You know, and I think another observation was that they're not particularly supportive of others. And I have a high-powered health professional who comes to stay via my Airbnb, and I was talking to him about burnout and how they're not particularly supportive. And he said, well, we don't exactly have the luxury of 2-hour lunch breaks where we can sit with our colleagues who may be experiencing burnout or depression and put an arm around them and listen to them in a collegial, supportive way. He said, my lunch involves grabbing something from the cafe while I'm running from one patient to the other.
Yeah, and I think that's so true, Sheldon. I mean, I actually do a bit of work at the Auckland University Medical School with the medical students. And time again, you know, I hear stories about this on clinical placements of just how pushed doctors and medical students are. You know, they're working long shifts, 12-hour shifts, over and above their time, often days on end without days off, and environments which, you know, are under-resourced, understaffed. You know, they're carrying a lot of responsibility. You're talking about life and death here. You're talking about human lives. And also the profession as well attracts, you know, health professions attract people who are naturally often highly driven, perfectionistic, compulsive, want to rescue everyone else, you know, really want to care and support everyone else, but often at the expense that they neglect their own well-being. And I think this is the reality of the situation doctors are in. So I really think there's a big social component, there's a big societal component, and we have to look at the conditions that doctors are under as well. Yeah.
Do you think that we're talking about the average GP as well? I mean, a lot of this research that we've accessed on the internet appears to be public hospital specialists or public hospital doctors or junior doctors, and also dentists working in public hospitals. So all of them are saying, what in terms of incidents of burnout, what sort of incidents of burnout are some of these or our research indicating?
You know, you asked if it will be prevalent among GPs as well, and although we don't have statistics on GPs specifically, my impression that I get, you know, just through talking to medical students who work in this field, is with the GPs, it's quite unique. It really depends on the culture of the practice they work in, also whereabout, you know. Often, probably sadly to say it, in Auckland, there's probably a lot more pressure than there is outside of Auckland. So in some of the more rural places, you know, that rate of burnout doesn't seem to be so high. But particularly, I think the main issue is public hospitals and public health settings. So, you know, likes of Auckland Hospital, North Shore Hospital, these big, busy, you know, publicly funded places. This seems to be where the...
And a lot of the frustration, it appears from the research that we've identified, is that their frustration often comes from the people that are running and managing these hospitals. And I also put this to this high-level professional, health professional who stays with me, and he said, well, you know, there are doctors that move into management as clinical representatives, but they're often caught up in the culture of administration and management, and really they seem to add to the frustration, he said, for doctors practicing, you know. So, yeah, it must be a tough environment, I think, and generally a high level of pressure and that sort of thing. The interesting thing is that I think in our survey, only 7% attributed their burnout to their interactions with patients. So that's a positive thing.
Yeah, definitely. And I think that highlights what we've just been talking about, because only 7% attributed to patients, which I'm quite relieved about, but nearly half of them said it was due to their work and frustrations with their work. So yeah, I think that says a lot about what we could do to help prevent burnout in our health.
What about what's happening in our schools with school principals and teachers and that sort of thing? What are the surveys saying there?
Yeah, that was interesting as well. So school principals seem to be, I guess, the next people in line in terms of experiencing burnout. So their burnout figures for school principals were almost double what it is in the general population. And they also find that school principals, about 70% of them work more than 50 hours per week, and actually about a quarter of them work more than 60 hours a week during term time. So if you think like a 60-hour week is a normal thing for a quarter of our school principals, that's concerning. That leaves some questions there.
It's quoted here as saying principals experience high levels of emotional demands and emotional labour. What would you understand as emotional labour?
Again, it comes back to what we're talking about with doctors and health professionals. They're responsible for, school children, young children. They hold the responsibility of that entire school, whereas with school teachers, they may hold responsibility for one classroom, which is, a high enough responsibility. But for the principal, there's a lot falling on their heads in terms of if there's bullying at that school or anything happens, that could possibly be reported in the papers. There's a lot of responsibility on them, to manage that. And also now, particularly in New Zealand, with the school results, the figures, there's a lot of pressure, I think, in principals to not only keep the children in the school culture safe, but also to be achieving, to be successful, to be getting up to that decile 1, decile 2, or
decile 10.
Decile 10, sorry.
Yeah, decile 1's down the bottom.
Yeah. In New Zealand, we have some of the highest rates of domestic violence,
child abuse,
child abuse, and suicide as well, and that's, these are the realities that principals are facing every day.
Yeah, so the Principals Health and Wellbeing Survey in 2016, I think it was commissioned by the Primary Sector Union, the New Zealand Educational Institute. It spoke to almost 400 principals across the country and also to deputy and assistant principals. And as you say, it found that over 70% were working over 50 hours a week, and a quarter of them more than 60 hours, and so I think it says here that this increases the sort of work-family conflict. I guess work-family is well, they're devoting so much time to their work that they're not able to devote much time to their families.
And that's it. I mean, if you have someone that's at work over 60 hours per week doing a lot of emotional labour, as we talked about, that doesn't leave much time or energy for them to go back home and spend that time with their families.
On Mental Health Radio, Take It From Us, I'm host Sheldon Brown, and I'm talking to Vikki Baird, counselling psychologist, who's talking to us about burnout. It's the second show that we've done on burnout, and if you're interested in catching what Vikki said about burnout in the first show, you can go to planetaudio.org.nz/Take It From Us, or our own Take It From Us website, which is www.takeitfromus, all one word, .co.nz.
We're just talking about that in terms of the, emotional labour they put into being responsible and caring for the children and dealing with the family issues as well as the school issues.
Yeah, so this Principals Health and Wellbeing Survey that was done last year says that stress was reported at 1.8 times the general population. This is among principals. And problem sleeping reported at almost 2.5 times higher. Women in particular reported significantly higher rates of burnout and problem sleeping than their male counterparts. So there's that theme coming through again, Vikki, that women seem to be more vulnerable, more susceptible to burnout.
Yeah, that's certainly true. Yeah.
It noted that most principals and school teachers had a healthy alcohol intake and did not take to the bottle to manage stress. I'm not sure whether that's the case with another profession that we can turn to, and that's lawyers. Is there much survey or research onto burnout among lawyers in New Zealand?
Not particularly in New Zealand, it seems. We did get some statistics from the US that said that lawyers are actually over 3.5 times more likely to suffer from depression than non-lawyers. So 3 times more likely is a pretty significant figure. I would suspect that there might be some similar figures in New Zealand, or certainly there might be higher rates of depression and burnout in New Zealand. So although we didn't find any specific statistics for New Zealand, what we did notice was that, the Law Society does dedicate quite a significant part of its website to information about depression and burnout. I find this a bit confronting because, to say the solution is simple is actually not true. I think what we're looking at is that it's actually quite complex. If the solution was simple, then, we wouldn't be having these burnout figures. So, hopefully we can talk a bit more about that and we can give you guys some tips on how to manage your well-being. Because we're dealing with personality components of people, we're dealing with social work pressure, work cultures, which are not often quite not supportive. So it's a whole complex array of things, and particularly that, that thing that we've mentioned about not being able to say no, there's a real reason for that, why people have that, and it's often related to, quite ingrained and deep past experiences. So it takes a bit of work, to actually learn to say no sometimes. Well,
I mean, isn't, not saying no, that's a rather stumbling way to put it, but I think we want to please people. I'm sure that I don't say no because I want to please people. I want to be seen to be willing to do work, willing to help people, willing to help out, I guess. I think we worry about the repercussions of saying no. That we may be seen as somebody who's not cooperative, who's not part of the team, who isn't prepared to go that extra mile. And so many of us these days, I think, working in health and mental health, are being asked to do more for less money, or at least the same amount of money.
And that's it, and so there's the personal component and that social component, often it's not just even about people pleasing, but it's, issues like, if I say no, is this going to affect my job? Is this going to affect my future? And I think that's the real issues that are going on for a lot of New Zealanders. And we've highlighted different health professions. Like, I'll give you an example from doctors, say from doctors, like for instance surgeons. you say, okay, just say no, don't work overtime. But if you're in a situation where you're a group, you're a member of a team in an operating theatre, there's complications, you've already done a 12-hour shift, those complications take you overtime, you still have another person to operate on in your surgical list for that day. Your decision to say no, to go home, means that someone's surgery might be held back for weeks or months. That's a real kind of, just to highlight, that's the real choices that doctors have to make, I mean, that's extreme.
Very graphic. Well, I wonder if it is that extreme, actually. I think that's a very real example of why surgeons, doctors, health teams are working such long hours.
Yeah, that's it. If someone calls in sick, and in the next shift, then it falls on those people in that shift. Like, do we stay on? That could make a difference to life or death for patients, So, yes.
And that's the business they're in, isn't it? Caring for people, trying to get them well again. I guess the other thing about saying no is that there's a pretty good chance that one of your colleagues are going to be called in to do the job, and if they do a very spectacular job or very effective job, then they're shining when you're sitting in the shadows.
And that's it. And that's another good point. And actually, it reminds me of one of the issues I had when I was experiencing burnout. It was slightly different from that, but again, on the same line, I knew if I called in sick, that would put pressure on my colleagues, who I also were experiencing effects of burnout and stress, so I was also aware of that. Like, I'm feeling burned out, I can call in sick, but how is this going to impact my colleagues? How much more stressed will that make them? So it's really complex.
What else? What are some of the other things that we can do to counter burnout?
So again, I guess around that topic of healthy boundaries, which is what saying no is about, it's things like, people can do other things, like, for instance, leaving work at work, having some kind of ritual or some kind of process that you go through when you leave work. It might be leaving your files or, switching your phone off or whatever it is, leaving it at the door. Or it might even be taking a few deep breaths as you leave, so you can emotionally, move from one place into the next, from work to back home. So those little things we can do. Also taking a bit of me time every day, So you might be working in a stressful environment. It might be difficult at times to say no to overtime. But one of the things you might want to introduce is 5 minutes, 5 minutes earlier in the morning to just have your cup of tea or coffee, have that quiet time. Taking those micro breaks can make a big difference.
Taking a pause or doing a little bit of mindfulness early in the morning. I mean, it's a discipline that I've adopted.
And the next item we had was exercise as well. So even when we're really busy, really full, thinking about what kind of exercise we can do, and that doesn't need to be going out for an hour at the gym. It might be something like taking a 10-minute walk in your lunch break, or just getting outside, walking around. It might just be something like parking your car a bit further away and taking that extra 5-10 minutes to walk to work.
Well, that's a reality in Auckland anyway, isn't it?
Yeah, that's
trying
true.
to find a car park anywhere close to where you're going.
So making it work for you, so not stressing yourself out, but introducing small little bits of exercise, maybe even 5 minutes of yoga in the morning. So that's one thing. Another thing is, becoming expert at relaxing. Schedule in pleasurable activities. And again, you don't need to stress yourself out, but small pleasurable activities. It might just be going for that after work drink with your colleagues once a week for a couple of hours. It might be just meeting a friend for a coffee. Just a small thing can make a big difference.